then there's no point of doing AR. Anyway, patient will be incontinent after your surgery, so you might as well do APR. And you have to get the consent for what cholesterol? Chemical? Specific concepts. You will get the consent for permanent cholesterol. Huh? You want to get doctor or journalist? Janamadi Vedic dia kan no masih kian ni kan sudah mulai namanya garang ring band 2400 इतना बारह mulai बारह को सब देवल का mulai क्या है आओ नहीं right so can you come day 1 day 2 day 1 में था मैं operation day of day 1 2 that is the week 100 your pulses. Tell me what pulses. Spew spikes. Charan. Ten of the three differential diagnosis. Infection for meningitis is also infection. Tonsillitis also infection. Rhinitis. Pneumonia, all are infections. Be specific. Surgical site infection. Echara. Pelle padina ila oskiri arnathina. This is oski. Echara yalla. Itu. What do you call that?
Post-operative Pyrexia. Post-operative
SIRS. Anything else? Infection herpes? No. What infection? What infection? What is your concern? Why you are not telling me? It's too early. Yes. You don't have third one. When you don't have a second one, you don't have third one. Okay. Sanduni. Fossils. Okay, surgical site infection. That's it. Pre-existing infection. Pasnya macam kalau bila mati lah hilang koskin bila ini. Hilang koskin kita lihat ni. Take a value. Arsha.
SIRS, surgical site.
February. Non hemolytic febrile transfusion. As he said, it's too early to have infection. Why Pyrexia infection is called? It's an elective major surgery. Do we do an elective major surgery in a patient with Pyrexia infection? You can of course postpone this surgery 1 week. We can treat that and do it in 1 week. If the surgery here is IND of perineal abscess, then I take your answer. Yes. You have to go through the surgery also. So that's why there is no. So what are the other causes? So 2 already given. One is SIRS. The other one is if blood transfusion is given, non-hemolytic febrile transfusion. But that is a if. Anything without if? Drug reactions. What drug reactions? I mean, malignant hyperexia, parasite drugs. When that happens, intraoperative. Okay? Drug reactions will be so malignant hyperexia is wrong because it happens intraoperative and that PS spike is very high. And if that's so, that patient will be not in the ward. Right? What is the drug of choice malignant hyperexia?
Bromocriptine.
Huh?
Bromocriptine.
Bromocriptine? Cantrolate. Right. So, but that's why malignant hyperexia. So one is SIRS. How to diagnose SIRS? You said SIRS first. How to diagnose SIRS? Me too. Body temperature. Only high or low? High and low. Either less than 36 or more than 30. Hypothermia and hyperthermia. Anything else? Any other criteria? More than 11,000 or less than 4,000. Pulse rate more than 90. Tachycardia. Respiratory rate more than 20. So if you have 2 out of 4 criteria, you can diagnose SIRS. Right? So that's why pulse rate is very important. More important than beat. Okay, that's one. If blood transfusion. What the second one is actually basal pulmonary atelectasis. After general anesthesia, after major surgery, they can get basal pulmonary atelectasis, which can give rise to fever spikes. Not very high, but usual like this. So those are the common causes. So if you ask to write DDs for this, I will write SIRS and basal pulmonary atelectasis. If they ask third one, if blood transfusion is given, non-hemolytic febrile transfusion reaction. Basal pulmonary atelectasis. Atelectasis is lung collapse. Basal pulmonary atelectasis. If you write down, you can write down. Okay? No problem. Those are different. But if patient with fever spikes on day 3, 4, 5, like let's say this patient develops fever spikes on day 3, 4, 5, then comes your infection, right? So if you get this same fever chart and day 3 fever spikes, and if they ask differentials, then you can write down your infections. But you can't write same category. Now, line associated infection is one. You can't write subcat canal associated infection, IV canal associated infection, CP line associated infection. You will get only 1 mark for all three because that's the same category. Line associated sepsis, example, canal site infection. Surgical site infection, another category. Orthostatic pneumonia is another category. Right? Catheter associated UTI is another category. So then they can ask what are the investigations that you would do. So for CVP line associated infection, what is the investigation? You can take blood cultures from the CVP line and remove the CVP line and send the tip for culture and APST. Okay, anything else? For a surgical site infection, you remove few clips and send wounds off for culture and APST. So orthostatic pneumonia, sputum for culture and APST. Right? So catheter associated UTI, catheter urine for culture and APST. So those are the investigations. So that's about post-operative pyrexia. So remember, day 1, 2, 3 cannot be due to that. Now let's say I changed the surgery here. Laparoscopic anterior resection. That patient. For example, laparoscopic anterior resection. What is the difference between this patient and that patient? There is anastomosis. This patient does not have anastomosis. If you given a fever chart of that patient for day 3, 4 fever spikes, what else you can write? That difference. Anastomotic leakage. You have to prioritize your answer and you have to write that as the first answer and you get more marks. If you don't write that, because for that answer more marks will be allocated. So if there's anastomotic, that is your worry. Not that our anastomosis leak frequently. But if the patient develops fever spikes on day 3, 4, 5, that is what we want to exclude basically. Right? That is what we are worried about. So what is the investigation of choice in that case? If you suspect anastomotic leakage.
But
how do you identify for that? You can do ultrasound but better investigation. Contrast enhanced CT scan with oral and rectal contrast. What is the contrast that you are using? Contrast, how do you divide your contrast? There are positive contrast and negative contrast. Your AI is also contrast. Right? It's a negative. What are the positive contrast? Dark room में गया ना? अपने dark room में गया ये ना बैठ के उनकी करो. वहाँ तक केले की ना रूट तक एक जगह तो हुआ है. और है ना केले. कितना तो हुआ है. Now she says, sir. The only person that I hate from okay. ये अभी और एक बात करेंगे ना? Yeah. एक और कर लेना है. So, have you seen barium? Can you give barium in a suspected leak? Why? It's water insoluble. So if you give barium for a suspected leak, barium will leak through the leak into the peritoneum and cause barium peritonitis. It is lethal. Right? So you don't give barium, sir. You do water soluble contrast. Gastrographin is one of them. Right? You can do gastrographin study. Or CECT with oral and rectal contrast. Right? So that is the investigation of choice in a suspected leak. Okay. Sorry? Very minimum. Very minimum air. That gives more mucosal delineation than single contrast. Mucosal abnormalities are well seen and double contrast. So short case. Short case. Killing me. You are killing me, huh? Spouter. You think it's spouter?
No.
Huh? Gira hotel wage eliyata illa. Yeah.
Look at you.
Back in the camera. Wait. Baru pakai SPN. Mana doa lagi SPN. It is not functioning well. The gas is there, it is not. But if she has gone and removed the fissure, oh that may. It indicates it is functioning. This round is wasted pepper. If you want to see surrounding skin, what can you tell the exam? So I would like to remove the bag and examine surrounding skin. But why do you want to? Why are you concerned about surrounding skin? What are the complications related to surrounding skin? Surrounding skin. Skin and ganglion. Excoriation. Is it common with this stoma? Which stoma?
Ileostoma.
Ileostoma. சொல்லுங்க. Okay. Constipation. படவே බඩ වේදන හරියට ඉලක්ක දෙන්න බඩ යන්නේ බඩ බුබුලට යන්නේ නේ අරක වතුර බොන්නේ වෙලාවට කන්නේ පවුනේ right so to get this short case there are few things that you have to comment. Stoma is added to a man human. First you get the consent on the patient and who tell about you. I am a medical student now. අවසානයේ වෛද්‍ය ශිෂ්‍යාවක් මේ මගේ අන්තිම විභාගේ මට කෙලවෙන්නයි යන්නේ. මට උදව් කරන්න. ඒක කියන්න එපා. මම අවසානයේ වෛද්‍ය ශිෂ්‍යාවක් මම පොඩ්ඩක් පරීක්ෂා කරලා බලනවා. If you are going to touch, you have to ask whether there is pain. So then you can. My command was to comment about the device. So you can say there is a stoma. There's averagely built elderly lady lying comfortably on the bed, and there's a stoma placed on the left lower quadrant of the abdomen, and it is connected to a stoma bag, two-piece bag. Two-piece this has a separate base plate, and you can disconnect the bag. Sometimes it comes as a single apparatus, right? So two-piece bag, and it is the effluent. There is no effluent, but it is filled with gas. So you have to comment about the site, you have to comment about what is the bag and the effluent. Okay? So next is you comment about the stoma. So you can see, right? You can see the stoma. The fact that there is a drain, if you get this patient, the fact that there's a drain and plasters around, so this is a recently created stoma. But if you don't see any of these things, it's a mature stoma, right? Let's say this was done 2 days before your exam and ඔයාලගේ exam එකට මේ ලඩාව මේ පැත්තට අරන් යනවා. දෙන්න පුළුවන් එහෙම. So just comment about it. Huh? Just describe what you see and then the stoma is pink in color. That's the color that you want to see, right? I would like to remove the bag and do and insert my finger and see how many lumens are there. That's another one. Because this can be M stoma. This, you know this case, but what I'm saying is at the exam you don't know what is the case, right? If you get a stoma at the exam, you don't know whether it's a APR or whatever. So that's something that you want to tell the examiner. So I would like to remove the bag and examine. So then examiner, what do you want to look for? So number one, whether it's a flush stoma or a spout out stoma. But do you get spout out stoma on this side? No. So it has to be a flush stoma. But if you see a spout on this side, what is that? It's a prolapse stoma. It's a complicated stoma. So prolapse colostomy. Right? If you get it on this side. Fistula. Fistula का फिल्म में मेलियट नहीं बोलना. Intrauterine fistula के बड़े वालों में लेते हैं. Intrauterine fistula के ना बड़े वाले में लेते हैं में महामटा इतनी discharge है. Right. So that's number one, whether it's flushed or spout out. The next thing is the number of lumens, because it can be a loop stoma or an end stoma. Then look for complications. What are the stoma complications? No, initial complications. The main complications. Stoma necrosis. Stoma necrosis. Late complications. Necrosis stoma common pain. Color change. This is either blackish red, blackish red. That is a necrosis, stoma necrosis. Bleeding. Those are the acute complications. Late complications, if you get a stoma which is mature, what are late complications? Like a monkey vessel, prolapse, retraction, stenosis. Right. Those are the stoma complications. Then around the stoma, there can be skin excoriation, but again not likely in this patient. Right. Any other complication?
Yes.
Parastomal hernia. Right. So then you look for, how do you look for parastomal hernia? You ask the patient to cough. If you see it bulges out, then it's a parastomal hernia. So you look for those complications. Right. Then you examine, just look at the rest of the abdomen and comment about the scars. Patient has a lower midline phalansteal scar. Right? To conclude, you have to offer something else. You have to tell them, sir, I would like to examine the perineum. To do a DRE, there should be anus, no? You examine the perineum and see whether the patient has anus. If the patient has a patent anus and an end stoma, what is that surgery? Hartmann surgery. If the patient has a closed perineum, there is no anus, and this, what is that surgery? It's a APR. So finally, to conclude, you tell the examiner, sir, I would like to examine this patient's perineum and see. So what do you want to see? If it's a, then you can conclude whether this is a Hartmann's procedure or this. Okay? Clear? Okay. So that's a stoma examination. Okay? First the general picture.